Hello everyone, welcome back to Last Night Dentistry. Today we are going to discuss one of the most important and high yield topics in dentistry known as dental caries. Dental caries is the most common chronic infectious disease known to mankind. It is a progressive, irreversible microbial disease of this calcified tissues of the teeth, characterized by demineralization of the inorganic portion and destruction of the organic matrix. If left untreated, it can progress from enamel to dentine, leading to pulp and even cause periapical and facial space infections. This topic is extremely important for your BDS exams, OR exam, ADC exams. Let's understand in detail. First, etiology and epidemiology. Dental caries is a multifactorial disease involving four main factors: the host, meaning teeth and saliva, microorganisms, diet, and time. The most important bacteria are Streptococcus mutans and Lactobacillus. Sucrose is the most cariogenic sugar. Epidemiology involves caries is directly related to sugar consumption per capita. It is higher in developed countries due to refined carbohydrates, but now increasing in developing countries due to adoption of Western diets. Prevention programs like water fluoridation have helped reduce caries in many regions. Clinically, what we see is that dental caries is classified into several types. The most common is pit and fissure caries, followed by smooth surface caries, root surface caries, and recurrent caries. We also classify it as acute rampant caries, which is rapid and severe, and chronic caries, which is slow progressing. Understanding these types help in both diagnosis and treatment planning. Now coming on to the next slide, let's discuss pit and fissure caries in detail. This is the most common and most destructive type. It occurs soon after eruption, especially in the first molars. The lesion starts narrow at the surface but widens at dentino-enamel junction, undermining the enamel. Clinically, you see black or brown discoloration at the base of the fissure. This form often remains hidden until it causes pain or large cavitation. Next are smooth surface and root caries. Smooth surface caries commonly occurs on proximal contact areas and sometimes cervical regions. The lesion is triangular with base toward the dentino-enamel junction. Now, root surface cemental caries is common in elderly patients with gingival incision. The root surface is soft, so the caries progress rapidly towards the pulp. This is frequently seen in patients with xerostomia or radiation therapy. Now moving to the next slide, at the special caries forms. Recurrent caries and special forms are very important for your exams. Recurrent means secondary caries occur around existing restorations due to micro leakage or poor marginal adaptation. Nursing bottle caries or rampant caries is seen in young children who sleep with a bottle containing milk or juice. It severely affects the upper anterior teeth. This is a classic exam scenario. Now coming to pathogenesis and histopathology. Caries begin with plaque accumulation and acid production, leading to demineralization when pH drops below the critical level of 5.5 for enamel. Histologically, enamel caries has a triangular shape in dentine. It spreads faster laterally due to dentinal tubules. The pulp responds by forming reparative dentine. Early lesions show different zones under the microscope, the translucent zone being the advancing front. Now, diagnosis of caries have evolved significantly. We use virtual and tactile examination, but bitewing radiographs are the best for detecting proximal caries. Advanced tools include ICDAS scoring system and Diagnodent. Remember, uh, early white spot lesions are reversible with demineralization therapy. Now, here are some most important high yield points for exams. Most common type of caries are patent fissure caries. Most cariogenic organism is Streptococcus mutans. Critical pH for enamel is 5.5. Most common in elderly are root caries. Most effective prevention is fluoride. Caries in preventable and reversible in its initial stages. Now, coming to the scenario portion. Finally, let's revise with some exam style questions. As I have told, most common type of dental caries are patent fissures. If a 3-year-old child with severe decay in upper anterior teeth walks in your clinic due to bottle feeding, what would be your diagnosis? That is nursing bottle caries or rampant caries. Caries commonly seen in elderly with gingival recession are known as root surface caries. Recurrent caries occur mainly due to micro leakage at restoration margins. Critical pH for demineralization of enamel is 5.5. These are very frequently asked concept across all exams. That's all for today's lecture on dental caries. This is a fundamental topic. Master the concepts, classification, and prevention strategies. Revise these slides regularly. If you found this helpful, please like, share, and subscribe to the channel. Hit the bell icon and comment below which topic you want next. Share this video with your friends preparing for exam. Thank you so much for watching. Keep studying hard and stay consistent. Take care. See you in the next video.